Welcome to the squat. So today we're going to look at a fundamental lower body exercise called the squat. We're initially going to start with a body weight just to get some of the teaching points discussed. So we've got Ewan here. Now the squat is a fundamental lower body exercise, as I mentioned. It's pivotal for getting on and off of a chair, for example, which is obviously something that we would do multiple times. So it's crucial that we have that level of conditioning. Joint and muscle wise, the knees and the hips and the ankles are the major movers here. We've got the hip extensors, the knee extensors, and to a certain extent the ankle plantar flexors, along with all the torso musculature that will aid the stability in maintaining this upright position. So for this exercise, we'll have the feet just about hip width apart and the toes slightly turned out, around about 30 degrees. So we'll get you into really lift his sternum up towards the ceiling. That will straighten out the thoracic curve. And it's crucial he maintains a good level of lumbar lordosis there, so a good amount of spinal neutrality throughout the whole exercise. Hand position wise, we can have the client have option 1, which is having the fingers on the temples, option 2 on the hips, or option 3 with a counter swing, which is as he travels down, his arms will swing upwards. What we want to try and avoid with this exercise is having the arms placed in front of the body, as people like to do to help their balance. A couple of reasons why this isn't ideal is that it encourages kyphosis of the spine by placing some of the body weight in front of the spine, which is not ideal. Also, we can think of it as developing a faulty movement pattern because it's not really how our bodies would squat, so we can train the neuromuscular system to squat or to learn how to squat with the arms in front. So keep the arms, temples, hips, or a counter swing. So you will get you to keep them on your temples. You're going to lower yourself down, think about driving the hips backwards. The knees can travel about 2 to 3 centimeters over the toes, no more. They want to stay in line with the second metatarsal. He's got a good level of lumbar lordosis there. We can use a dowel rod just to assess that. I'm kind of happy that we might just arch a little bit more there. Good stuff. Now, if this lumbar curve was lost through the pelvis tilting posteriorly, as you can see there, that's A, incorrect. B, puts his entire spine under danger of compressing his discs. And generally is not a safe place to be. So we'll come up slightly there, and his ability to maintain lumbar lordosis is going to dictate his squat depth. So as soon as that curve is lost, he's gone too deep. So hips no lower than the patella itself. Okay, you can come up from there. You will do 2 or 3 more reps there, please. So 2 to 3 seconds on the way down, and 2 to 3 on the way up. Keeping the navel drawn in, and he can breathe however's comfortable. Common mistakes for this exercise, we can have the hip shifting to one side on the descension, as Ewan's going to show us there. This might indicate a deficient glute medius and glute minimus, or some other of the hip stabilizers. The knees may deviate medially on the descension, which again we would look at to correct with some corrective work and maybe some stretching. Also, if someone's got an anterior pelvic tilt or tight hip flexors, an excessive amount of forward lean. Good, so we would encourage the torso to remain upright and address the hip flexor tightness through a separate program. So we're going to incorporate the barbell now to create a barbell squat. Identical teaching points to the body weight squat, we just got a bar to consider. It's always wise to get the client used to doing a body weight squat first before we incorporate any load. So with the barbell, ensure it's set up on the rack around about armpit height, as Ewan's going to show us there. Excellent. Now the exercise itself is identical to a bodyweight squat, we just need to consider how to set up the bar. So Ewan's going to get underneath the bar. Grip wise, we want the hands obviously on the outside of the shoulders, and they can go as close to the shoulders as is comfortable, just to maintain a level of rigidity. So we want the bar across the upper traps, not on the middle or lower traps, or obviously on the neck. And the hand position is so that the hands are as close to the shoulders as is comfortable for the client. So from there, Ewan's going to rack the bar, take 2 small steps away, and perform a few reps for us there, please, Ewan. Excellent, and rack the bar there, please, Ewan. Good, and that's the barbell squat.